Hello everyone, welcome back to the channel. I think all of us know what happens to a person after drinking alcohol, right? Oh wait, is it really? Do we really know what exactly happens to a person? I think we just know only the superficial aspect of it. In this video, let's find out what exactly does alcohol does to the body and the brain and what our body does to the alcohol. So it's going to be an interesting video. Make sure you watch it till the end.
कौन कम वक्त बर्दाश्त करने को पीता है?
See, everything that we eat or drink does not necessarily get absorbed completely from the intestine. And the amount of absorption of the food or the drink is highly variable depending on a lot of factors. So what about alcohol? So in case of alcohol, fortunately or unfortunately, the absorption is almost complete and it gets distributed to almost all the body parts. Should I say no wastage? See, this is the chemical structure of alcohol or ethanol. So after ethanol gets absorbed, the body converts it into aldehyde. Now the conversion of ethanol to aldehyde is done by two enzyme systems. Okay, so what are enzymes now? Enzymes are basically molecules which are required to carry out a particular chemical reaction. In other words, they are catalysts. So practically in human body, no enzyme means no chemical reaction. So conversion from ethanol to aldehyde is done by two enzyme systems. First one being alcohol dehydrogenase or ADH. This ADH is predominantly found in the liver and in the intestines. Now, this is responsible for conversion of minimal to moderate amount of alcohol intake. An interesting fact here is that the amount of conversion to aldehyde by alcohol dehydrogenase is lesser in women compared to men. What does this mean? So it means maybe females or women are more likely to get the effects of alcohol than compared to males. In the same way, the amount of ADH in person's body is highly variable, and that is the reason why alcohol hits differently in different individuals. Or in other words, alcohol tolerance is different in different persons, especially because of the amount of alcohol dehydrogenase enzyme present is highly variable. The second mechanism of metabolism is by the enzyme system called as MEOS system. This usually comes into play in case of a very high amount of alcohol intake, that is binge drinking, or in case of chronic or long-term frequent high amount of alcohol intake. So as a person consistently drinks more and more amount of alcohol for a long time, more and more MEOS system gets activated, and this is also the reason why as the person drinks more and more, his alcohol tolerance capacity keeps varying. So now the body has converted ethanol to acetaldehyde. What next? So this acetaldehyde gets converted next to what is called as acetate. This conversion from acetaldehyde to acetate is done by the enzyme system called as aldehyde dehydrogenase. Why is this important? This is very important because there are a lot of medications which inhibit the action of aldehyde dehydrogenase. Drugs like disulfiram, metronidazole, cephalosporins, the last two were the antibiotics. These basically inhibit the effect of aldehyde dehydrogenase, leading to accumulation of aldehyde in the body. So accumulation of aldehyde leads to a lot of uneasy feeling, including severe headache, nausea, etc. That is the reason why you might have seen in the movies or somewhere else saying that I don't want to drink today because I am on antibiotics. Well, not all antibiotics cause this. Only a few antibiotics like metronidazole, cephalosporins, etc. So basically, they prevent the conversion of aldehyde to 2-acetate, leading to aldehyde buildup in the body, causing a lot of uneasy effects of alcohol. And mind you, this acetaldehyde dehydrogenase can be genetically very minimal in quantity in some individuals, and that is the reason why there are people who basically suffer from a lot of uneasy feelings after drinking of alcohol. Now let's look at the effect of alcohol on the different body organs. Let's first consider the acute or the immediate effects. Effect of alcohol on the nervous system. See, all the points that I mentioned is not necessarily seen in all the individuals. A person may have a combination of these symptoms. First, alcohol can act as a sedative. In other words, the patient may become excessively sleepy after consumption of alcohol. The person may lose what is called as social inhibition and can talk or act inappropriately. Alcohol can impair judgment. It can cause ataxia or loss of balance. Now, these two are the most important factors because of which a person should not drive after drinking alcohol. It can obviously cause slurred speech as well. Coming to drunken driving, impairment of driving can occur at blood alcohol levels of 60 to 80 milligram per deciliter, while levels of 120 to 160 milligram per deciliter are associated with gross drunkenness, and levels more than 300 milligram per deciliter are associated with loss of consciousness, sometimes even coma with breathing and heart related problems, and levels of above 500 are usually lethal to a person's life. Okay, let's address a very important thing that you might have heard. Drinking rum in winter, does it really help to keep you warm? What do you think? Okay, let's try to exactly analyze the science involved in that and try to understand what exactly happens, whether it is rum or any other forms of alcohol. The effect of alcohol on the heart and the smooth muscles which are present in the blood vessels is that it relaxes them. So as a result, the muscles which are inside the blood vessels relax, leading to vasodilatation. That is, the diameter of the blood vessel becomes bigger. This especially happens in the blood vessels of the skin and the subcutaneous tissue, or the tissue just beneath the skin. So what happens? As a result of that, more blood flows to these tissues. So as more blood flows to skin and subcutaneous tissue, the person gets a false sense of warmth. What happens after that? Because of vasodilatation, because of excessive blood flow to the skin and the subcutaneous tissue, there is also excessive amount of heat loss from the body to the surrounding. So as a result of this, eventually this leads to hypothermia or decreased body temperature of the person who consumes it. So drinking rum or any other form of alcohol in winter may give a sense of warmth initially, but eventually it leads to loss of heat from body and causes hypothermia. Now let us look at some long-term effects of alcohol on different body organs. Let's come to the nervous system or the brain. One thing is tolerance and dependence. It mainly happens because of two reasons. See, as we know, our brain usually gets adjusted to anything and everything that it encounters. If you live in a very quiet surrounding, you become a person who cannot tolerate much of noise. Similarly, if a person consistently drinks alcohol, the brain gets habituated to that, brain gets used to that, and the same amount of alcohol in the future may not be sufficient to give him that same kick. Well, this also happens because of another mechanism which I told previously, that is, long-term alcohol intake leads to increase in the MEOS system, and hence there is increased metabolism of alcohol to aldehyde, again leading to increased requirement of alcohol to get the same effect. An interesting fact here is that there are a group of medicines which also act by the same common pathway as alcohol. So chronic drinkers may have the effect that those particular categories of drugs don't really work on them at that dosage, and they may require increased dosage to get the desired effect from those medicines. The next organ is, of course, liver. All of you know that chronic drinking can affect the liver, right? Yes. So in the initial stages, the damage to liver is still reversible when the person is still having only fatty liver. But this chronic insult to liver, if it continues, it enters irreversible stages. It can cause hepatitis, cirrhosis, and then eventually complete liver failure. And another fact here is that the damage to liver because of alcohol is more likely in women than compared to men. But we still see more of male alcohol liver disease patients compared to females. That is simply because the incidence of chronic drinking is more in males than compared to females. But yes, females are at a higher risk of alcohol-induced liver damage than compared to males. Effect of alcohol on the intestine. Ultimately, intestines are the ones which take direct brunt, right? Because what you drink reaches the intestines first. So, long-term alcohol intake leads to irritation and inflammation of the intestines. Now, as I told, alcohol gets absorbed completely, but the irritation and the inflammation which causes to the intestine leads to malabsorption of different food substances or nutrients from the intestine. Add to this, the chronic drinkers usually tend to develop neglect towards their routine food intake, which also will contribute to malnutrition. Long-term alcohol intake is also found to increase the risk of pancreatitis. On the nervous system, it causes what is called as peripheral neuropathy. In simple words, damage to the nerves of the limbs. And rarely, chronic alcohol intake, which leads to deficiency of one of the vitamin called as thiamine, which again happens because of two reasons. One is because of malabsorption, second is because of the neglect that the person shows on the food intake. So this chronic alcohol intake, which leads to thiamine deficiency, can cause what is called as Wernicke-Korsakoff syndrome. If this is untreated, it can cause permanent memory loss called as Korsakoff psychosis. Okay, let's address one more interesting thing here. You might have heard people saying that drinking alcohol in moderation is good for heart. Is it really true? Well, there are some studies which have shown that limited consumption of alcohol is found to increase the amount of good cholesterol in the body, or in other words, it is HDL in the body. But do remember, the catch here is limited consumption, not binge drinking, because long-term high amount of alcohol consumption can cause hypertension, it can cause decreased hemoglobin, it can cause a dilated cardiomyopathy, or in simple words, it can make you a big-hearted person, which can stop at any time. And binge drinking is also associated with arrhythmias or disturbed rhythm of the heart, and again that can cause sudden cardiac arrest. So when you say alcohol intake is good for the heart, you need to take it with a pinch of salt. Okay, so all these problems that we discussed are to the person who consumed it. Can alcohol trouble someone who has never consumed it? Unfortunately, yes, it can. And it is none other than the fetus who is sitting inside the mother who consumes alcohol. So, alcohol consumption by the pregnant ladies can affect the fetus and cause what is called as fetal alcohol syndrome. Fetal alcohol syndrome is a very serious condition and can cause mental retardation, growth retardation, small head or brain called as microcephaly, and characteristic underdevelopment of the mid-face region. So these are some acute and chronic effects of a long-term alcohol intake. This of course is in addition to the social and economic problems which alcohol consumption causes. So in the next video, let's discuss about how to get rid of this and alcohol de-addiction. I hope you found this video informative. If so, make sure you give it a thumbs up. Thank you for watching.